All right, looks like good time to get started. Hello, everyone, and welcome to Minnesota HIMSS webinar series. I'm Vitaly Hirasevich. I'm professor of anesthesiology and medicine at Mayo Clinic and your host today. It's my pleasure to introduce our today's speaker, Dr. David Mark. He is a department chair and health informatics graduate program director. He is an associate professor in Department of Health Informatics and Information Management on the College of Saint Scholastica in Duluth. He is a Minnesota product and received master's degree in biological science and PhD in health informatics from the University of Minnesota. He is also certified health data analyst. Dr. Mark served as a former chair of the HEMA Foundation Research Network and as a member of the HEMA Council and for Excellence in Education, where he was co-chair educational programming work group. He also active with national HIMSS and served as HIMSS Technology Informatic Graduation Education Reform Community and HIMSS Student and Careers Committee. Dr. Mark is a frequent speaker at the state and national meetings and workshops where he speaks on the topic related to the healthcare data analytics. He is an accomplished researcher and author of the publications related to storage and retrieval of the publicly available healthcare data and health information and information management workforce trends. Today, he is going to talk about putting public data to work from the healthcare perspective. Welcome, David.
Thank you, Dr. Hirasevich, and thank you to all of you for attending this webinar today. I hope you find the information enlightening, and it is certainly a topic I'm passionate about, so I'm happy to share it with you here today. Obviously, I'm not going to read to you my biography all over again. So there's really three main outcomes that I'm striving to get at the end of this talk. First, to examine the current state of public data access, then explore data sets that are healthcare focused, that are publicly available for discovery and analysis, and then illustrate some of the uses of public data for business intelligence and research. I'm just going to start with some level setting. When we talk about data, what are we talking about? So, really it's anything that's really stored digitally. Data can be encoded in many different standards based off of place, based off of type of data. So in the United States, a lot of data is stored either in a UTF-8 type of format. It's oftentimes, when you're opening up like a Microsoft Excel spreadsheet, it may be in a UTF-8 format or an ASCII format as well. If you think about pictures, they're oftentimes stored in a JPEG format, or video and audio files in MPEG-4 format. All of those are different encoding standards in which data are stored in a digital format. Data can be stored locally on your computer. You might store something to your desktop and access it that way. But more often than not, it's going to be stored in the cloud, whether that's on a cloud-based drive or on an internet, and you can then share data with others. The data can be formatted in a variety of ways depending on the type. That's, regardless of the encoding method. So it might be formatted, in a spreadsheet on an Excel file, or maybe it's a .csv file, or maybe it's stored as a .dat file, or a JSON file format, or maybe an XML file, for instance. And nowadays, a lot of that data is accessible online on the internet. We've reached a culture of data sharing, and this has really been driven by the internet. It's created what we call a data revolution. A lot of data is collected and it's stored online, and storage is becoming cheaper and cheaper. We know that by, you go in and you look at cloud-based storage methods, and if you have to have more space and you have to purchase it, it tends to be pretty inexpensive. And most people have access to the data. You can have access to the data from your computer that you're using, or maybe it's from your cellular telephone, or there could be other modalities of access as well. Internet technologies are now paving the way for more data sharing. Think about it. If you want to share something with a colleague, you have email that you can share content with. You have online storage like Google Drive, like Box, like and many other mechanisms as well. You have social media. You want to share some content like a video or a picture, or maybe it's just a dialogue that you want to offer. Social media is a rich place for data sharing. Streaming platforms like YouTube offer opportunities to share. And then journals and libraries. So when we need access to an article or to a book, many times we're going to the internet to get access to that. Online shopping, or just shopping in general. You're going online to read reviews that are people sharing content and information about their experiences with products and so forth. The benefits of making data like that type of data available are numerous, and you can think about it even in healthcare. If we make more healthcare data accessible to the general public, why is that something we want to do? One reason is transparency. The federal government has made tremendous efforts to support access to data so that data is available to the general public. And part of that, the reason is for citizens to be able to monitor government activities. This has led to greater citizen participation in government affairs. Whether that's citizens who may be interested in research on their own, or maybe they're in an academic setting like myself, where I'm using public data to support my own research efforts. It could be journalists, reporters who are accessing the data. I mean, there's many examples in which citizen participation has been aided by access to data. There's also public service improvement. By offering citizens the raw materials needed to engage with communities to improve public services, it's led to efforts that have, public health agencies, or even at the municipal or county or state level, have been able to be more diligent and direct to offer services that are meant to improve their target population. Innovation and economic value is one other reason. By accessing data publicly, it supports the design of new technologies, services, and data-driven products. We see a lot of technologies actually being developed that are on the basis of accessible data sources. We also better understand potential markets and customers. Population health is just one example of that. Is healthcare consumers, they're a customer. How do we understand them? Well, we understand them based off of who they are as people. In aggregate, it's looking at who they are as a population. And then there's efficiency. It's less costly to discover and access data when that data is available online to the public. That can probably be debated, though. I want to begin this talk by talking about public data sources. I want to give you some idea of, what are we talking about when we talk about public data? I'm going to cover some different examples of data that's available online. Public data, which is stored either in repositories or standalone data sets. Then I want to contrast that against other types of data, like licensed data or even synthetic data. So public data, the term public is a term that is used to describe data that's freely available on the internet. So although it's freely available, it's not often readily accessible. It can be difficult to find that data. It takes effort and work to search, through, it could be through internet search engines to be able to access or discover and access the data. The format of the data can be widespread. It can take on many different formats, and oftentimes it can be messy. You may have to access that data programmatically. You can't just open it up in Microsoft Excel, for instance. there may actually be restrictions on use, and it may require permissions as well. An example would be, think about Facebook and how much data is out there. There's efforts where some of that data can be made available to the public, but you need permission to get it, and they're going to give it to you in a format that it may not be, as easy to work with. They may give you access to what's called an API, and that will allow you to access their data, but you're going to have to basically have calls to be able to pull that data from their online sources. Now, in contrast, open data is data that's freely available, can be readily accessed, used, reused, and redistributed. This data is readily accessible. It's oftentimes just there for the taking, and it can often be managed by government agencies. It's particularly when we're talking about healthcare data. There's no restrictions on use. You could use it for research. You could use it for development of software or technologies. There's really no restrictions. The format does tend to be more structured and usable, and it's often stored in a repository. I'm going to share some examples like Data.gov or Data.cms.gov. Now, public data, it can be open, but that isn't always the case. So it's just something to be aware of, that sometimes when you're talking about public data, it doesn't mean it's open data. There may be some restrictions. The open data movement, really, you've all heard of open source probably, and the term open really originates from the term open access. So the word open from open access has been used in other contexts now, open data, open source. And the idea is that around open data really gained attention in 2008. There was this Murray and Rust article that was kind of a response to this article by this researcher named Bush, who in 2007 and 2008, they published these articles about basically a call to action in Nature Proceedings. It was like, hey, there's all this data out there. Why are we not making it accessible, readily accessible to the public? And there were then efforts to kind of contain that and be able to create some policy and change by offering greater access to the public. Obviously, the internet helped popularize the concept of open data, and then government agencies launched initiatives that just blew it all up. Despite that effort, now we're quite a few years into this, we're still in the infancy of the open data revolution. It began in 2009 in terms of the federal government's participation. The day that President Barack Obama was sworn into office, he signed a memorandum for transparency in open government. And over time, that transitioned into creating resources and tools to support access to government data. Data.gov was created, and then this community site called HealthData.gov was developed to allow public access to healthcare-related data sets. In 2014, there were 2,000 important, that's a loaded term, important data sets that were published online. That was part of the directive, is that federal agencies had to publish at least 2 important data sets annually to the public. What they considered important was rather ambiguous, though. In 2017, there were 3,000 data sets published. If you go to HealthData.gov now, I think there's a bit over 4,000 data sets. So, it's about doubled in size over a course of 8-9 years. So we've still got a ways to go. COVID-19, when that hit, there was a lot more public awareness about access to data, particularly data related to COVID-19. And there was an international initiative around this open government partnership that developed a platform for data sharing for COVID-19. The hope of this open government partnership is to support the access to data that goes well beyond COVID-19. So it'll be interesting to see how work progresses with this into the future. So I'm going to begin by talking about data repositories. This is one way in which you can access data. A repository is simply a collection of data sets, a collection of data, I should say. It's typically related to a particular domain. In our context, we're going to talk about healthcare. And the way that the data sets, so think about when I say data sets, kind of in your mind, think about a spreadsheet, okay? That's just a way to simplify it. But a repository would be a collection of those data sets that are in those data sets are then described with metadata. So metadata is going to be things like the title, maybe a description. It's going to give you, information about the author that published that information. And that's the basis of a search in the repositories. And then it oftentimes includes a URL that then links you to the actual data set where it resides somewhere on a website online. Here's an example. So if you go to HealthData.gov, there's this data set, it's COVID-19 reported patient impact and hospital capacity by state. And if you go to HealthData.gov and find this, all those things that I've outlined in red, that's metadata. So you have the title, you have the date in which the data was updated, you have the publisher of the data, who to contact, you have keywords, which are tags at the very bottom, you can see that. And there may be other metadata elements that maybe aren't fully described yet. And then if you were to download that data, so click on the URL where you click that view data, it'll take you to that URL, you can download it. This is what the data looks like on the right side of the screen. It's a CSV file, so it's a comma separated values file. It's in a text file viewer right now, but this is what the data looks like. You certainly can open up this data in Microsoft Excel to be able to view it, or open it up in many other platforms in analytical tools to be able to work with that data. But this is just a preview. So the metadata is describing that specific data set. And the repositories are a collection of all of this metadata that's describing these specific data sets. There's a problem, though, with that metadata, as you could have seen in that prior example. We're trying to grapple with a data avalanche, and really as a society, we're struggling with it. The metadata that's being used to publish and describe data sets, it's oftentimes has issues. The metadata may not accurately describe the actual data set it's representing. That's a problem. There's inconsistencies. One data set might be described with certain verbiage. It might have different ways of records that are describing it in terms of the metadata fields that are completed, and others may not include that information. An example would be maybe there's information about when the data set was last updated, and then another data set doesn't have that. There's completeness is a challenge. There's very often incomplete records where we just don't have all the metadata fields that are completed. Sometimes currentness is an issue, that the metadata hasn't been updated to reflect the most recent data sets that are being published on the topic, or that the metadata is pointing to. And accessibility. Sometimes that metadata is not linking to an actual data set. So we've got problems that need to be overcome. Here's some examples of data repositories that I would encourage you to visit. The first is Data.gov. This is like the government go-to place for public access to data. And it includes data on many different areas, healthcare being one, but you'll see environmental data, agricultural data, you'll see financial data, economic data. So there's a lot there. The community site of that, which is basically a subset of Data.gov, is HealthData.gov. This is the healthcare health data repository for the federal government. You're going to find more data there than what comes from federal agencies, though. There have been other organizations that have participated in publishing their data on HealthData.gov. There's many different topics, many different data sets that are included there. One that you may not be familiar with is the Google Dataset Search. And I in this presentation, I have all the links available at the end of the presentation, but if you get access to this presentation, you can click on this text and get access to the links directly as well. The Google Dataset Search is one. It's basically using Google technology to be able to search through websites that might have access to data. And also it includes, like that, the same concept from other websites. There's metadata that's describing data sets that'll link you out to those specific data sets. It's good. There's still some challenges with the Google Dataset Search. in that it's not an exhaustive list of all the data on the internet, for sure. And sometimes it points you to things that aren't really, maybe like what you think of as a typical data set. It's not necessarily pointing you to like a spreadsheet all the time. So it could be like a graph in a peer-reviewed journal that it might be pointing you to. There's a CMS data navigator. This is basically a tool that could allow you to search through all the different data sets that are publicly available by the Centers for Medicare and Medicaid Services that could offer you a lot of insights around hospital performance, healthcare outcomes, a number of things. CDC Wonder is similar, but it's data that's being published by the CDC. It's predominantly, well, all of it I think is around diseases. So you could be looking for, cardiovascular disease, COVID-19, diabetes, many different areas. AWS Data Exchange is an interesting one. This is a tool that Amazon Web Service created that allows you to basically use an API, which data suppliers can basically load their data up into these AWS S3 servers and give access to their data to others through this data exchange. So then you can utilize this API to access data from third parties and use it in some of the AWS analytical products and tools. So it is a neat way for data sharing, but you have to be a subscriber to the AWS tools. Kaggle is one that Kaggle started off where it was supporting data analytics competitions. So if you go to Kaggle, you're going to see an opportunity to participate in these data competitions, and where organizations basically sponsor projects, and whoever has the best algorithm is awarded the prize. Kaggle, though, is a rich place for data that can be, some of it you have to have attribution to the data set, some of it you have to have permission to use the data for purposes beyond like a competition, but that isn't always the case. So it isn't a good place to go if you're looking for data on many different topics. It's not just healthcare. There are many different types of data sets there. GitHub is a forum where developers can share software and code with other developers. Many times, though, they offer access to data sets that are available because they use that data in their platforms. If you are an R programmer or you use Python or many other tools you might be using, those are the two that I use most often. I go to GitHub often to look at what other people are using, to look at their code to get ideas on how do I want to approach projects. And oftentimes they have data sets that might be a way for me to test my own code, or maybe I'll actually use some of their data sets they're using. Harvard Dataverse is an example of a tool, a repository that offers access to over 140,000 data sets related to research. So it's where researchers can volunteer in uploading data to the Dataverse to share, archive, to cite, to explore research data sets. And it's a voluntary project, and it's a way for researchers to collaborate. There's many others, though. This is just an example of some of the more popular ones. The acquisition of how data gets on these repositories can vary depending on the site. Most often they're user submitted. So someone working for a federal agency, they're going to be a person in charge of uploading the data to HealthData.gov. And the nice thing about that is it's a human that's including the information about the data set. So they're having to key in all the information. The good thing about those data repositories is that there's a lot of data there, but the con of it is it can be difficult to find what you're looking for. It might be limited in scope, and unfortunately, some of the metadata can be out of date. There's also web crawlers. This is like the Google Dataset Search. This is where it includes, again, a lot of data, but some of the format and the metadata may not be very accurate. It may be difficult to know if the results of the search are really relevant to what you're looking for. So it can be difficult to find what you're looking for. And then there's others that originate from a website. And these I consider not really data repositories, they're standalone. And it's something like county health ranking. This is where data, you have to go to a specific website. The data is oftentimes up to date. It can be not an exhaustive or comprehensive data set, but it often requires data to be merged with other data sets to really fully realize the potential of the data set, and it's limited in scope. So CMS would be kind of an example of a repository where, granted, CMS has a lot of data, but it's limited in scope to, data that's related to CMS hospitals that bill to Medicare, and data related to Medicare beneficiaries, for instance. Standalone data sets are data sets that are maintained by an entity and published on their websites. Now, a lot of these data sets can be discovered on those data repositories. So if you don't know where to begin with the data repositories. But as you become more familiar with the data sets that are being being described in those data repositories, you probably just want to go straight to those standalone data sets in the future. I'm going to describe some of the more popular standalone data sets. So IPUMS is one of the first data sets that I've used regularly. This is provides census and survey data from around the world. And there's one data set in particular that I find is really useful for a healthcare kind of focus. It's the National Health Inventory Series. It's NHIS, National Health Inventory Series. And basically it's data that is, each row of data represents a person, and you get information from the US Census, and they change their questions year over year, but it's individual level data related to healthcare. So it could be, how often do you go to the doctor? How often do you go to the dentist? Hey, do you use a email when you're to communicate with your provider? It could be, have you ever been a user of tobacco? Do you have any of these types of diagnoses? There's many, many different questions that are asked, and it is part of like a shoot off of the US Census. And it's supposed to be a representative population of the nation. The problem with the data is you can't get to a specific geographic location. The level at which you can describe a population is at the region. So like Northeast, Midwest, South, Southwest regions of the United States. County health rankings, I really like this data set if you're interested in population health. This is a data set that is, offers county level statistics and around health outcomes, around demographics, around social determinants of health, like insured rates, socioeconomic status, their income levels. There is information about transportation, internet access, really, and it changes year over year, but you can actually go back and look at the archive data in addition to the most recent data. I think it's published, I could be wrong on this, but I think it's published twice a year. There's the compare data sets. This includes things like hospital compare, nursing home compare, provider compare, hospice compare. This is data on outcomes related to a hospital or nursing home or hospice unit or even a physician. And it includes data such as CAPS, so like HCAPS, which would be patient survey data from inpatient stays. It includes some information on beneficiaries related to cost, related to health outcomes. There's data on hospital acquired conditions. So it's really that facility level data. Dartmouth Atlas has payment data that is can be useful for understanding beneficiaries and cost of care. CDC Places is similar to county health rankings, but it's maintained by the CDC, even though some of the actual sources of the data are the same. But it includes information about how many people have certain diseases. So the percent of the population with that have had a stroke, that have cancer, and so on. CMS payment data, public use file, that's the PUF stands for. This includes information on inpatient, outpatient, Part D drugs, durable medical equipment, hospice, and it's data that's limited in terms of it's not fully exhaustive data, but it can be aggregated by provider, by location, by drug brand name, by HCPCS codes, by CPT codes, or MSDRG codes. There's also Minnesota Public Health Data Access Tool, which is a tool that includes environmental public health data that is intended to be used to inform on policy, development, or help communities in planning, and uncover major issues that are, plaguing the population of Minnesota. So it includes things like exposures to hazardous materials, socioeconomic factors that can influence health, environmental issues, trends, and so forth, at the level of geographic, like county. And then the Minnesota Demographer website is also really interesting to explore. This includes demographic information, education information, economy, information on immigration and language, income and poverty, and so forth. There is also some labor force data on there and some health-related data. What's interesting about this is you can get down to the school district level. So it's a more granular type of data that you can access. Okay, moving along here, there's also license data. These are data sets that oftentimes require a subscription or a payment to be able to access the data. The data doesn't always require a payment, but it's still licensed. You may have to sign a data use agreement, and that data use agreement may specify limits on the use and distribution of the data. There is often, you have to have appropriate attribution if you do something with the data. So if I use a data set that's licensed and I publish an article on it, I have to, of course, have appropriate attribution in how they want it attributed to that data. Some of the data sets actually, to get the data, you have to go through a training to know how to utilize the data appropriately. So there's a level of accountability. The data can be expensive depending on the source as well. Here's some examples. HCUP is a very common one. This is where you can get data on, different payers data. So you can get, the data includes information on inpatient, emergency department, ambulatory visits. There's data on children, adolescents as well. It's focused on healthcare utilization and cost predominantly. The OPPS claims data is claims level data that is on outpatient prospective payment systems. So hospitals that participate in OPPS, and it includes outpatient claims, like you'll get information on the diagnoses of patients, provider information, procedural information, and each row is an individual claim. The Healthcare Cost Institute offers claims data for medical and pharmacy encounters, and there it includes data in over like 55 million commercially insured individuals and 40 million Medicare insured individuals. So it's a very large data set. NCQA offers data on health plans. This is where you can go if you're interested in HEDIS and CAHPS performance measurement data. So it is, again, another very large data set that you can access and use. Another example of a licensed data set is this N2C2 NLP data set. You don't have to pay for that data, but you do have to sign a data use agreement to get access. And it's intended to be provided for research and training purposes on working with clinical notes for support in developing natural language processing algorithms. There's also synthetic data, which I think is pretty neat. It's data that is artificial, meaning it's totally fake, yet it's supposed to be realistic data. It's oftentimes generated using algorithms that were originally developed from real data. What's nice about this data is I use it for training purposes. Like if I'm teaching a workshop or even with my students, I use synthetic data because I can give them patient level data that they can practice their skills in doing data analysis. But I could also see it being used by vendors like IT companies or technology companies that need to test out their products. You can customize so much, the size of the data, the complexity, the type of data, and it's oftentimes free. Here's 2 examples. There's SynPuff, which is synthetic claims data. So if ever you want to see what claims data looks like, go to SynPuff. It's, I think CMS created this data set, and it can be millions and millions and millions of rows of data. I've used it for training purposes. You get claims data on inpatient, outpatient carrier claims. You have made up beneficiary information and prescription drug events. I will say that the data is almost too clean. That's the problem with the synthetic data. It's almost too clean. There isn't as much messiness as what you get with real data, but that's just something you have to acknowledge and understand. The one I really like is Cynthia. Cynthia was created by the MITRE group, and it's really a neat tool. You can have a synthetic patient-level healthcare data that you can actually export the data in a CSV file if you wanted to, or a FHIR document, or an XML document. So it's a really cool tool that if ever you're trying to understand FHIR more in kind of the arrangement of the data, or you have a tool that is compatible with the FHIR standard, it's a data set you can utilize and experiment with. Or if you just want access to CSV files and want patient level data, but you don't want or care about it being real, here you go. And this is a really interesting algorithm that they use to create the data sets off of. So I encourage you to check it out. There's also data that can be used for simulation purposes. This is a project called the Islands, and you can simulate doing many different things on a simulated population. It's a virtual island population that you can give drugs to certain segments of a population. You can create your own experiments. You can do like surveys of this simulated population. You can perform different types of analyses, like or laboratory tests on this population. There's so many different things you can do. It's a little weird at times, but really, really interesting. And I could see how, if you're trying to kind of understand the implications of an experiment on a population, this might be a place to start. So just some considerations as you're getting access to some of this data. You got to know what format the data is in, and understand, what is the ideal format for your own, skill level, as well as the type of analytical tools you want to utilize, because a data set is really nothing without an analysis. So you got to oftentimes do something with it. Data formats can vary. It might be a text file where you have to open it up in like Notepad or text edit if you're on a Mac. It might be a CSV file, which you can open up in Microsoft Excel, as well as many other tools. But there's also data files that are specific to SPSS, SAS, R, a .dat file, which those are awful to work with, but it's like a universal standard that can work with anything. JSON or XML. Depending on the format, you may be restricted in how you work with it with specific tools. And you may need to parse the data programmatically as well. So, oftentimes you have to understand the data by looking at the data dictionary to really make sure you're using the data accurately. The size of the data sets can vary widely in terms of their size, which can pose unique challenges. Some of the data sets are so large that you can't open them up in a tool like Microsoft Excel. So you have to make sure you have the appropriate tools to work with the data. The age of the data, some of the data is outdated, and some of the data is updated frequently, but you can access the old versions of it. So just make sure you're using the most up-to-date version of the data if that's your, if that's what you're hoping to do. Of course, if you're looking for archived data, it's out there, you can oftentimes find it, but just be aware that you might tap into a data set that you're not actually looking at the most up-to-date data. Consider the also level of the data. When you think about what each row of a data set might be defined as, oftentimes it's a geographic setting, like it's publishing data by state or by county. It could be a hospital setting, or maybe it's a nursing home or something like that, where each row represents a specific hospital. It could be patient level data, where each row is a specific patient. It could be claim, each row is a claim. Finding patient level data, it's a challenge to find that online that's publicly available because it could potentially be identifiable, but it is out there. There are some, patient level data sets you could access. This was an article that I published with Dr. Harasovich, that we created a starter kit for geotagging and geovisualization in healthcare. We're looking at, what are the tools that you can utilize in accompanying, data to be able to look at the data in a different geographic space or place. So there are numerous geographic reference files that you can use as a way of adjusting data for a specific outcome. So maybe you want to look at data like, let's say, readmissions for heart failure, but you want to look at the county level. Well, you might have zip codes that you want to roll up into counties. Where are those zip codes located? This is where you would need something like a geographic reference file to do that mapping of the, one geographic code to another. Here's some links to some of the more commonly used codes. There's the RUCA, which are codes that are used to classify US Census tracts by, like you can know basically, are you in a rural area, an urban area, how urban of an area are you in? And it's based off of population density and like commuting patterns. What's very similar to that are the core-based statistical areas. There's also Tiger line files, and the US Census has a number of tools like the relationship files as well, where you can map things like FIPS code to core-based statistical area. So what do you do with public data? Well, obviously, like I've illustrated, you could use it for research purposes, population health. A lot of that's being done with publicly available data. You could look at financial data and be able to make some financial decisions using some of the data that's publicly available. Policy development, looking at how policymakers might be able to leverage and utilize publicly available data to, generate new programs that might benefit the population or their constituents. That's one way in which it could be used. There's many different types of analyses you can perform. You could do things like data mining and machine learning. You could do geospatial analysis. You could do disease modeling, or even do your own types of simulations. There's product development, where you could use public data for product research. Is this something that is important that the public would need? You could use public data as test data for software. It could be used for proof of concept as well. Strategic planning, whether you're looking at, creating strategic plans to address the needs of a community, doing program evaluation of whether maybe you've applied an intervention, you want to see if it's had any impact. Public data could potentially be used to measure impact. I want to provide you just briefly with some examples before we open it up to questions here of how public data has been used. So one example is research. So public data can be used for research. This is an example of a research article that was done. It was published just last year. And the intent of the research was to determine whether patient and nurse staffing ratios are associated with clinical outcomes for patients with sepsis. They use the MedPAR data along with Hospital Compare and data from the American Medical Association. What they found are, using this public data, are that for each additional patient that was added per nurse, it was associated with a higher odds of mortality and a higher odds of readmission and a longer length of stay. So they had a recommendation of basically improving hospital nurse staffing over and above what is currently in the sepsis bundles. And how they did this research is, again, with public data. Here's another example of an article that was published in 2019, and this used the IPOOMS data set, and using that NHIS specific IPOOMS data that I so much like. And this article in particular examined patient perspectives on the cultural competence of US healthcare professionals. So basically, there's data in this data set that looks at patient perspective of what their beliefs are and what their preference is for the beliefs of their providers. And what they found is that, many respondents to these surveys actually reported that they have a preference that their provider share their beliefs, or at least understand their beliefs, or at least ask about their beliefs, more so than people just not caring about whether their provider asks them about their beliefs. So the recommendation was that medical schools should consider improving the pipeline of diverse healthcare professionals and increase kind of cultural competence in their educational systems. Here's an example of how public data can be used for population health efforts. Now, this is a project that I worked on with the National Rural Health Resource Center. And basically, we used public data to create a population health educational portal. So the intent is to offer individuals and decision makers tools that they can utilize to look at different topics related to population health, like, oh, I want to look at data related to emergency department access or diabetes, or I want to look at data related to transportation and health status, or uninsured rates in behavioral and mental health. And we created these scenarios using publicly available data, and this portal is updated annually, and we have Tableau dashboards that allow you to interact and utilize the data sets. You can also use public data for benchmarking. Hospital Compare is one tool that can be utilized for these purposes. This is just an example where I pulled 3 of our local hospitals in the Duluth area. And here's an example of looking at HCAHPS data, which is patient survey data. And you can see, how patients responded to questions like patients who were always reported that their nurses communicated well, or their doctors communicated well, and which % of the population said yes, that they always communicate well. One thing to note is that in the dashboard that you go, if you visit Hospital Compare, you don't get the denominators for these percentages, but you can actually go and download the raw data set for Hospital Compare or any of the compare data to get those specific denominators. It's a weakness with their online portal, but you can get that from downloading the data itself. But this could be used for benchmarking purposes, and a lot of the, I think they're called like stoplight reports that are obtained. There's third parties that utilize Hospital Compare data that for supporting the development of benchmarks for many hospital outcomes as well. You can also utilize public data for policy. You can, for instance, this is data from county health rankings. If we look at data in the St. Louis County in Minnesota, and we want to look at certain health outcomes, maybe we want to look at something like the % of the population that have reported poor mental health days, or what is the average number of poor mental health days in the last 30 days. In St. Louis County, the average is 4.1 days for the last 30 days, which is related to the Minnesota average of 3.5, so it's slightly higher. So this might be an intervention saying, hey, we need to address this, the mental health of our population. So you can lobby for change through legislation or policy, or maybe it's creating some sort of service in a county to address these concerns. And there's public data for consumers. Here's an example of a tool that you can actually, it's a lookup tool for Medicare Part D prescriber data. The intended use is that consumers can get an estimate of whether their provider is more likely to prescribe a generic medication, or if they're, have prescribing patterns that could save the consumer money. I could see how this could be abused though. Basically, you can look up a provider and get information about their prescribing patterns of which drugs they prescribe the most, what is the number of beneficiaries, how many days supply, and the total cost of the drug that they supply. So that's interesting that that data is publicly available and can be looked up by anyone. I think you can get how some of that information may be abused. So in conclusion, there's a growing number of open and public data repositories that are accessible, basically to anyone that wants to access it for many different purposes. The metadata is kind of the basis of how you search and retrieve that public data, and the quality of that metadata varies widely, and that's an important topic that deserves further exploration. A lot of the data is described by geographic level. So you oftentimes have to get used to working with geographic data to understand the place of where the data is representing. And there's many different ways in which the public data can be used. You can use it by the general public, just as a healthcare consumer, to make decisions about your own healthcare, by healthcare leaders to look at, how are we faring against our competitors, by researchers that can utilize the data for many different purposes, looking at health outcomes, looking at population level statistics, by policymakers to create reform and change that can directly impact the population and constituents in which they serve. I'd now like to open it up to questions. Feel free to follow me on LinkedIn or shoot me an email if you do have any other questions as well. And at the very end of the presentation, I have some links to all of the data that was referenced in this presentation as well. But I'll leave it on my question slide for now. It's very
thank you. Yeah, thank you, David, for this presentation. It's very informative, and I just mentioned to participants what that is recorded and would be available on the Minnesota HIMSS YouTube space or so. Please ask questions. Type your question in the chat window or Q&A button tool, and we have couple more minutes for that. Okay, before we get any questions from participants, I have one question for you, David. Actually, that's a very simple question. There are a lot abundance of the data, a lot of data available online. Is there some initiatives, as you know, which take to assess quality of this data? Because everybody can place data these days, and just purpose not mislead community is to check that.
Yeah, no, there isn't a good quality check. There's a level of trust, like, oh, are the publishers of this data, the raw data itself, is it good? Is it valid? No, there's major assumptions that need to be made, but also, Vitaly, with regards to like the metadata that's being used to describe that data can be of poor quality. So this is where we have a long way to go in terms of access and use. So much data is used inappropriately, and I think that's a problem. That's like something that I think is a feature of the state of our world today. So what are the checks and balances that need to be in place? Should they be in place? But at least inform the user of potential challenges or issues with the data. But no, there aren't good checks and balances in terms of quality of the data.
Okay, thanks. Looks like there are some questions in chat window.
Yep, I see. Is the data updated regularly on these public sites? Yeah, some of it is. So if you look at if you go to HealthData.gov and you look at the COVID-19 data, some of that data is updated daily. Some of it hasn't been updated since, 2011 or when they first published the data. So some of it is really, really old. And here's the problem: is sometimes the metadata hasn't been updated, but it points to a data set that has been updated. So like we're at a point where it still requires significant amounts of effort in the discovery of public data.
Okay. Is there any more questions? Any questions from audience?
Well, I'll just say this is a topic I'm very passionate about. And if ever you want to, any of you have any desire in having a discussion about this, please feel free to reach out to me. And follow me on LinkedIn too, and I'm happy to engage in further conversation.
All right, yeah, we should probably conclude for today and close floor. Thank you again, David, for this presentation, and thank you, attendees, for spending time with us. Yeah, bye.
Thank you, everyone.